Welcome to the online information session for the Bariatric Center at Columbus Regional Health. I'm Dr. David Lee, bariatric surgeon and director of our program, which began in 2004. Since that time, we've performed more than 1,000 weight loss surgeries. Our comprehensive program includes a team of individuals who you will meet during your journey to health. Let me begin by telling you about the roles of other members of our team who assist patients through the bariatric surgery process. All patients undergo psychological evaluations prior to surgery from our program psychologists. Patients experience many changes in their life, not only physically but emotionally as well. It is important for patients to be adequately prepared to understand and respond to these changes. The psychologist frequently conducts support groups on topics related to emotional issues and the impact on weight loss success. In addition to providing information sessions at our office, the nurse practitioners provide medically supervised weight loss and follow-up care to our patients after surgery. Nurse practitioners also work closely with our dietitians. The clinical coordinator, who is also a certified bariatric nurse, is responsible for the overall coordination of patient care and education for our center. Our registered dietitian provides the initial dietary consultation for each patient and teaches the nutritional component of our preoperative education. After surgery, the dietitian counsels our patients on appropriate diet and nutrition and monitors their weight loss and nutritional status. They also present nutritional topics at support groups. During the next half hour, we'll discuss obesity, its effect upon your health, various types of weight loss surgery, and what to expect after surgery. Finally, once you complete this education, we'll direct you on what to do next if you feel you are a candidate for bariatric surgery and would like a consultation. Obesity is a lifelong, progressive disease that causes many secondary health problems. These are referred to as comorbidities. Obesity is not a cosmetic problem, a character flaw, or a problem with willpower. Obesity is determined by an individual's BMI, body mass index. This is a calculation of weight and height. We know that a person with a body mass index between 20 and 25 are most healthy. As the BMI increases, so does the risk for illness. People with a BMI over 30 are considered obese, and those with a BMI over 40 are considered morbidly obese. Morbid obesity is the point at which serious medical conditions can occur as a result of obesity. Individuals with a BMI greater than 40 generally weigh about 100 pounds over their ideal body weight. Now, to be considered for bariatric surgery, an individual must have a BMI greater than 40 or a BMI greater than 35 with obesity-related illnesses. So this slide shows a typical BMI chart. If you can find your height along the left side and then move across the chart to your right to your weight, your BMI will be at the top of the column. You're not alone in your battle with weight. Obesity affects many Americans. Approximately 1/3 of our population is obese, and this number has steadily increased over the past 20 years. A large number of our healthcare dollars are spent each year on obesity-related illnesses. Obesity affects many organ systems in the body. Many illnesses, comorbidities, are directly related to the effects of obesity, such as high blood pressure and heart disease, type 2 diabetes, obstructive sleep apnea, high cholesterol, arthritis, joint pain, and many others. Certain types of cancers are also related to obesity. People who are obese have 1/3 the chance of living to age 65 compared to individuals who have a normal BMI. Obesity is not easily treated with conventional methods of diet and exercise alone. There are very few medications that are marketed for the purposes of weight loss. These are beneficial only while they're taken and usually are used for only a few months at a time. Once these medications are stopped, weight regain usually reoccurs. Bariatric surgery is the only proven method to help individuals achieve successful weight loss. But weight loss surgery is only a tool and not a cure. Sustained weight loss still requires compliance to diet and exercise in order to achieve a healthy weight and a reduction and/or resolution of comorbidities. Surgery is the tool that allows you to eat less and to feel satisfied. Prior to undergoing surgery, we require our patients to be tobacco-free. Each person participates in our comprehensive program that includes evaluation by the surgeon, a dietitian, and a psychologist. Medical tests are performed that include blood work, an EKG, chest x-ray, an ultrasound or upper endoscopy, and other tests as needed. You'll participate in comprehensive education with our program coordinator and one of the dietitians. We do require attendance at least 2 support group meetings. At the Bariatric Center at Columbus Regional Health, we offer 2 types of bariatric surgery. Next, we'll discuss and compare the different surgeries. Before we do that, we'll discuss the normal anatomy of the stomach and gastrointestinal tract. To fully understand what changes occur with weight loss surgery, we first need to review normal GI tract anatomy. When we eat, food enters the stomach through the esophagus. Digestion begins in the stomach where food is mixed with stomach juices. Normally, the stomach is about the size of a football and it can hold about 1.5 liters of food. After food leaves the stomach, it enters the small intestine where it mixes with digestive enzymes from the liver and the pancreas. The food then goes through many feet of small intestine where nutrients and calories are absorbed. Waste products of digestion then enter the large intestine or the colon where fluid is reabsorbed, and then the waste is eventually eliminated from the body in the form of stool. The Roux-en-Y gastric bypass procedure was long considered the gold standard of bariatric surgery. It is the best studied procedure and until recently was the most commonly performed weight loss surgery. Typically, the outcomes of all other bariatric surgeries are compared to this procedure. It is both a restrictive and malabsorptive surgery and results in rapid weight loss and improvement of comorbid illnesses. This procedure is generally performed laparoscopically. The abdomen is entered through 6 small incisions to allow placement of a camera and instruments. The restrictive portion of the operation involves creating a small stomach pouch, about the size of an egg, from the upper portion of the stomach. The small intestine is then separated about 3 feet beyond the stomach. The lower portion of the small intestine is then brought up and attached to the stomach pouch. The upper portion of the small intestine is reattached further down. The amount of food that can be eaten is significantly smaller. This is the restrictive part of the operation. The larger portion of the stomach and the first part of the small intestine have been bypassed, and this results in the malabsorptive component of the operation. The remaining stomach, the liver, and the pancreas continue to produce digestive enzymes, which do combine with the food, but further along in the small intestine, which results in fewer calories being absorbed. These changes result in rapid and durable weight loss, and there is also rapid improvement or resolution of diabetes. Diabetic patients are frequently discharged from the hospital without the need for medication. With appropriate attention to diet and exercise, one can expect to maintain this weight loss for many years. The typical hospital stay is about 1 or 2 days. You can expect to be out of bed shortly after surgery and will be expected to walk every 2 hours. Your diet begins with clear liquids the day of the surgery. It's very important that you sip liquids frequently. Due to the small size of your stomach, you will no longer be able to drink large volumes at a time. Your diet will steadily increase over the next few months, but will be in much smaller amounts. But you will be satisfied with these small amounts because of the size of the stomach. For the first 6 weeks, much of your nutritional needs will be provided by protein supplements. Because of the smaller food volumes and the malabsorption associated with this procedure, you will need to take vitamin supplements for the rest of your life. These consist of a multivitamin, iron, calcium, and vitamin B12. You will also take Prilosec or a similar medication to decrease stomach acid for 3 months after the surgery. This protects the opening between the stomach pouch and the small intestine, which is susceptible to irritation by the acids that are produced in the stomach. Anti-inflammatory medications like ibuprofen and Aleve should be avoided as they can irritate this opening as well and could cause ulcers to develop. The greatest amount of weight loss occurs within 12 to 18 months of surgery. During this time, it's common to lose about 70 to 80% of your excess body weight. As mentioned before, there's rapid improvement or resolution of diabetes. This is also an excellent treatment for reflux. Most other comorbid conditions improve or resolve more slowly during the first year. No surgery is without the possibility of complications, and bariatric surgery is no exception. Dehydration is the most common complication following surgery. It occurs in about 10% of patients. Dehydration can cause you to feel weak, tired, and nauseated, as well as increase the risk of blood clots. It is necessary to drink a minimum of 64 ounces of fluids each day, preferably more, in order to prevent dehydration. During the first 2 weeks following surgery, patients are at risk for a leak. This is an abnormal opening along one of the staple lines between the pouch and small bowel, or at the reconnection of the small bowel. The staple lines are checked while you're still in surgery. If a leak occurs, this usually involves a return visit to the operating room for repair. The risk of this happening is 1 to 2%. Obese individuals are also at an increased risk for blood clots after any operation. These usually begin in one of the legs and could travel to the heart or lungs and could result in death. This is one reason for walking soon after surgery. In order to help prevent blood clots, you will receive daily injections of blood thinners during your hospitalization, and we emphasize the need to keep well hydrated with frequent sipping of liquids and frequent ambulation. An ulcer between the stomach pouch and small intestine occurs in about 6% of patients. It can be followed by a narrowing of the opening called a stricture, which makes swallowing of solid foods more difficult. An endoscopy may be required to diagnose either an ulcer or a stricture. Usually, medications can be used to successfully treat an ulcer. If there's a stricture, it can be stretched or dilated during the endoscopy. Following weight loss, bowel obstruction may occur due to an internal hernia after gastric bypass. As you visibly are losing weight loss is also occurring internally. The thin veil of tissue that holds our small intestine becomes even thinner and may allow bowel to slide through an opening and become trapped. This occurs in about 6% of patients and requires an operation to correct. Adhesions or scars on the inside of the abdomen, and they can also be a cause of obstruction. A side effect commonly seen following gastric bypass is dumping syndrome. This occurs when a food high in carbohydrate or fat is consumed. This food passes quickly through the stomach pouch and into the small intestine that is not accustomed to undigested food of this type. This can cause your heart to beat more rapidly, it can cause nausea, it can cause sweating, and eventually abdominal cramping and diarrhea. This syndrome is very uncomfortable and tends to cause people to avoid eating that type of food ever again. The sleeve gastrectomy is a newer bariatric procedure. We've been performing this procedure in our practice since December of 2010. This procedure acts by restricting how much food you can eat by decreasing the overall size of the stomach. During this procedure, a measuring device is placed in the stomach and a staple line is made along the device, creating a smaller stomach about the size of a banana. The excess portion of the stomach is then removed. This procedure requires no rerouting of the small intestines. Patients experience rapid and sustainable weight loss with this procedure. Similar to the gastric bypass, there is a rapid resolution of type 2 diabetes. Many previously diabetic patients are discharged from the hospital without the need for further diabetic medications. The hospital stay following sleeve gastrectomy is about 1 to 2 days. You'll be expected to begin frequent walks within several hours of the operation. You will begin sips of liquids right after the surgery. Frequent sipping of liquids is necessary due to the smaller stomach size. Your diet will remain liquid for the next several weeks before progressing to a soft diet. Again, protein supplements are necessary to obtain adequate nutrition after this surgery. You will also take daily blood thinner injections while in the hospital to prevent blood clots. Because of the smaller food volumes and removal of the stomach where the absorption of many vitamins occurs, you will need to take lifelong vitamin supplements. These are the same that we recommend for our bypass patients: a multivitamin, iron, calcium, and vitamin B12. You will also take Prilosec or a similar medication to decrease stomach acid for 3 months after the surgery. The anticipated weight loss following this procedure is 60 to 70% of the excess body weight over a 12 to 18 month period. There is also rapid improvement of comorbid conditions, including type 2 diabetes and high blood pressure. As with gastric bypass, there is a similar risk of leak, 1 to 2%. This is frequently managed with endoscopy rather than surgery, although surgery may be required for a leak if it occurs. The potential for dehydration and blood clots is similar to gastric bypass. We continue to reinforce the need for frequent sipping of liquids to ensure that you get enough fluids. There's a somewhat greater risk of postoperative nausea and reflux following sleeve gastrectomy because of the small size of the stomach, but these generally resolve over the course of time. Both of these can be treated with medications if they are a problem. Following any type of bariatric surgery, you can expect to feel better physically and notice improvement in your quality of life as you experience improvement in your comorbid conditions. Most people feel much more energetic and are able to exercise more easily. Most people return to work and their normal activities within about 2 weeks of surgery, although lifting greater than 20 pounds can be restricted for 4 to 6 weeks. While you're eating smaller quantities of food, you will still feel satisfied because the size of the stomach is so much smaller. For the first few weeks, much of your nutrition will be supplied by protein drinks taken between meals. Meals will only be a few to several ounces in volume. Due to the smaller stomach size, you will need to frequently sip liquids between meals and avoid fluids while you eat. It is very important to drink a minimum of 64 ounces of fluid each day, preferably between 80 and 100 ounces, in order to avoid dehydration. The types of liquids you drink may be very different than what you currently consume. You will need to avoid caffeine, carbonated drinks, and fruit juices. Examples of acceptable liquids are water, skim milk, decaf coffee or tea, or flavored waters. Vitamin supplements are a lifelong necessity after surgery. This usually consists of a daily multivitamin, iron, B12, and calcium along with vitamin D. During the first year, you'll be seen frequently for follow-up by either myself or a nurse practitioner. At each of these visits, you'll also meet with one of the dietitians to discuss progression of your diet. We will monitor your recovery from surgery, your weight loss, and nutritional and supplement status. Labs are frequently required during the first year, and their evaluation is essential to monitor for deficiencies and/or malnutrition. It is our goal to see you annually on a long-term basis to help you maintain your weight loss and overall health. Most insurance companies do offer bariatric coverage, but some do not. Some insurances have additional criteria that must be met, such as medically supervised weight loss. We encourage you to contact your insurance company regarding bariatric health benefits, but we will also help you to do this if this is necessary. If you do not have insurance coverage for this benefit, we can provide information regarding our self-pay packages. These packages include preoperative evaluation, the surgery, the hospital care, typical course of postoperative care, and all of our office visits that are required over the first year. This also includes insurance should you experience any postoperative complications. If you feel you're a candidate for bariatric surgery and would like to schedule a consultation, contact us and we will review your insurance eligibility and benefits and schedule an appointment. Thanks for participating in our online session.